is Maria Leonard. I am a massage instructor and Reiki master. I have been studying and practicing massage and energy work for 15 years and have seen the amazing things that it can do for people. Today, I am going to be giving you an introduction to craniosacral work. I hope that after viewing this video, you will have gained an understanding into the healing properties of this work. I hope to encourage you to go forward and receive a certification in this work so that you can add this to your repertoire as a healthcare provider. Before we begin, here is a list of supplies that you will need. Soft, relaxing music or a water fountain for relaxation. A massage table, preferably. Fitted sheet for the table and a sheet or a blanket. Pillow or bolster for under the knees. A rolling stool is also helpful, and water for your client. Your client does not have to take their clothes off for this treatment, but a massage table will keep you both comfortable, and sheets and a blanket will help to keep your client warm. Craniosacral work is a gentle form of body work that works with the body's natural healing properties. This work incorporates work performed using specific hand placements on the skull and also on the sacrum. This work has been taught by many different people and organizations. Two of these are Upledger Institute and John Barnes. What you will be learning in this video will be a technique which is based on the well-known vault holds and myofascial unwinding. This introduction to craniosacral work will show you one of the wonderful healing methods that exist in this world. We hope that you will find this technique appealing and that you will consider further training through one of the above mentioned institutions or any of the other credible workshops that exist. The craniosacral system is made up of the cranium, brain, spine, sacrum, and cerebral fluid. The cerebral fluid circulates through the brain and the spinal cord via the motions of the craniosacral system. This is done with contractions of the system. Believe it or not, but our brain does expand and compress. And while it is doing that, we are experiencing what is called a cerebral pulse. The skull contains what we call sutures. These sutures are lines, almost like stitches, that hold the different sections of the skull together. These are the frontal, parietal, temporal, and occipital lobes. These are the main suture points that we are going to deal with today. These sutures exist so that the skull can expand with the expansion of the brain. If the skull was to be one solid bone, we most likely would not be able to survive because our brain would not be able to expand and contract. For many years, this technique was not recognized or understood because of the subtleness of its benefits. But now you would be hard-pressed to find many people in the healthcare industry that haven't at least heard of this technique. Again, there are many versions of this technique. We will be giving you our version, which will incorporate different techniques, but in the end will help you to attain the results that your client needs. Everyone will react differently to this technique, and the results will vary. Just remember that it may take some people longer to reach the desired results, and then there are those that will react very quickly. You must stay calm, patient, and connected to your client at all times, and always reassure the client that they will reach the desired results when they and their body are ready. Craniosacral therapy can help with many different ailments. We're going to talk about a few of those that will be benefited by this work. Headaches and migraines, which are extremely common in this world because of the stress that people deal with. Some of those migraines obviously can be caused by chemical imbalances in the body, but craniosacral can still help to benefit those people that suffer from those. Low back pain, which is extremely common among most people. Spinal pain also. Facial pain, stress, all levels, physical, mental, and emotional. Fibromyalgia and chronic fatigue syndrome, which are two common disorders in today's society, especially for women. Now, some of the contraindications, we do need to be aware of these, are cerebral swelling, a brain aneurysm, and blood clots. There are lots of different contraindications too, but those are the main ones that we need to be concerned about. You will want to check with the client's healthcare providers before moving forward with this technique. You need to be open and accepting of all possible releases for your client during the body work. Do not question, and continue to be the facilitator and allow the client's body to do what it must to release. What is also interesting about this work is that some of the releases that occur are quite amazing and hard to explain. We have to remember that the human body and everything contained within it is a mystery. Every day, new things are being discovered about how the human body works. We only use about 10% of our brain. So my question is, what else is happening with the other 90% of our brain? What more is there left to discover? Obviously, those are unanswered questions. It is all very exciting and will always continue to be that way. Our body remembers all traumas and other things that have happened to it over its lifetime, and it remembers it to a cellular level. So it is expected that some deep-rooted memories may arise during this work, and we should be prepared. So it's good to have some Kleenex on hand, maybe snacks for people that might get their blood pressure rising or the levels in their body changing. Water always. Maybe a recommended counselor or doctor's list for people also. When you are performing this work, it can also be quite relaxing for you. Sometimes you may find yourself starting to quote-unquote unwind because you are responding to their releases and to your own. Be sure to stay calm and allow yourself to release gently. If you find that you are releasing quite a bit, you will want to ground yourself and shield yourself so that you may perform your work without too much interference. As you learn this technique, you must be prepared to practice many times over before performing on an actual client. Practice on your friends and family until you are sure that you are feeling everything you need to, and that you can distinguish such things as the heartbeat from the actual cranial pulse. I will demonstrate a grounding technique for you. There are many other ways to ground yourself, but we will start with this technique for today. I would like you to sit down in a comfortable place. Place your hands palm down on your legs. Take 3 deep breaths and allow yourself to start to feel the tension leaving your body, all the way from the top of your head down to the tips of your toes. Once you start to feel yourself relaxing, I would like you to picture yourself as a hollow tube and visualize a white light running through your body and also all around you. Focus on this light and think of it as that healing energy flowing through your body. Allow yourself to release and allow the energy to flow. Picture this energy connecting to the earth and holding you there, keeping you focused and clear-minded. Good. Now that you are feeling more grounded and connected to the earth, focused and clear-minded, we will begin. How is craniosacral therapy administered? Craniosacral therapy is administered through monitoring the rhythm of the cerebrospinal fluid's flow through the system. Craniosacral therapy practitioners attempt to balance the life force energy within the body. Because the movable skull, sacrum, and coccyx, which is your tailbone, are attached to membranes encompassing that cerebral fluid, experienced clinicians can actually detect any motion. Light, hands-on work assists the hydraulic forces, which are natural to the craniosacral system, to improve the body's internal atmosphere, thus strengthening its ability to heal itself. The brain sends messages down the spinal cord to the sacrum. Signals are then rerouted to all parts of the body through the nerves that depart from our spinal column. By freeing tension from the spinal cord, the cerebral spinal fluid flows more freely. Craniosacral therapy optimizes the rhythm of the spinal fluid and influences the entire body. It is relaxing, safe, and effective. After craniosacral therapy is administered, a common state of relaxation occurs, and it also improves your mental performance. If you would like to feel energized, whole, and happy, craniosacral therapy is definitely for you. I will give you an explanation of each hold we will be using today and what each hold is used for. I'm going to give you a little demonstration using a pillow, and you can use this at home also, to kind of give you an idea of what the motion is like with the craniosacral system. It's not going to be as dramatic as what I'm going to show you here, but this will help you to understand kind of what's happening. If you take a pillow, you will notice if you push in and then allow the pillow to expand again, it pushes your hands out. That's kind of what's happening with the skull when you're working on it. So push in and then allow the pillow to expand. Push in, there will be some resistance, and then expand. That is kind of what you're going to be feeling with the skull. But again, it's not going to be that dramatic. It's going to be very subtle. First, I am going to point out the suture points that we will be dealing with. You will need to know these points so that you can perform this therapy. So here we have the skull. The suture points, I'm going to give you a general indication of where they are. Obviously, we won't be able to see them perfectly because we have skin covering the actual skull. We have the frontal lobe, which is right here, which basically a suture point is going to be running through here. Then we also have the parietal lobe. We have suture points running over the top of the head and then kind of along the side and behind the head a little bit. We also then have suture points right here at the temporal lobes. And then on the back of the skull, we actually have the occipital ridge, which is right here at the bottom, and this is the occipital bone. Those are going to be the main suture points that we will be dealing with. With our hand placements, we're going to be touching lightly those suture points, and that is going to help with the release the client will experience. We will be beginning with hold 1. This hold is used to help you find the actual cranial pulse. This pulse is created as the cerebral spinal fluid is flowing through your brain, and your spine. What we want to accomplish with this hold is to not only distinguish between the actual heartbeat and the cranial pulse, but to take the client to what we call the still point. And the still point is where we actually help to slow down the cerebral pulse to a point where it's barely moving. This will help to take that client to a really deep place of relaxation. The still point is the point also where the cranial pulse is going to slow down to a number less than the normal beats that it has. It usually has 8 to 12 beats per minute. Much slower than your actual heartbeat, and this is important to remember. We will close our eyes when we are working on the client and try to focus on feeling the actual pulse or rhythm. This may take some time to be able to actually distinguish, but we must master this before we can move forward into any of the other holds. First, you will need someone to practice on. Once your client is comfortable, you will need them to close their eyes and take some deep breaths with you. This will help the both of you to become more connected so that you can feel the actual subtle changes in their cranial rhythm. Once your client is on the table, you want them to scoot down towards the end of the table so that you can rest your arms on the table like this. This will be more comfortable for you while you're performing this work, because we do stay in certain positions for quite a long period of time, sometimes. You want to be relaxed and comfortable as to not let the distractions that can happen interfere with your technique. Now we're going to place a hand on both sides of the head, trying to place your fingers so that they're connected with all the cranial sutures that I pointed out earlier. We need to place our hands like this so that we can actually feel the cranial pulse. So I have a couple fingers behind the head a little bit, and then I have them spread out here so I'm hitting all of those points. My thumbs are kind of resting at the frontal lobe and the parietal lobe sutures. Now, try to relax your hands, wrists, and forearms. You do not want them to be stiff. We want to be very relaxed during this treatment so that we can allow the client to do the movements that they need to as they're releasing. You will not be applying any pressure. You will just be placing your hands and fingers where I show you. Now we wait. We are waiting to kind of feel a slight ebb and flow to the cranium. Kind of like what I showed you earlier with the pillow. It's almost like a magnetic pull, pulling your hands together, and then two polar opposites kind of pushing them away. This can be very difficult to feel at first, so do not become disappointed if you do not feel anything. Now, what you may feel initially is the actual heartbeat of the client. This will be a much faster pulse, so you will know that you're feeling their heartbeat. Remember, the cranial rhythm is only about 8 to 12 beats per minute. It will kind of help you to remember that difference between the two, if you can tell the difference between that heartbeat and the cranial pulse. A minute actually can feel like a really long time when you're just sitting here, so be aware, again, it's just 8 to 12 beats per minute. Close your eyes and allow your breathing to slow and come synchronized with the client. Do not force anything to happen. The body of the client needs to do the releasing. We will sit here for a short while in a second, and we'll allow ourselves to try and feel that rhythmic pulse. Again, you want to feel almost like a magnetic pull first, and then your hands kind of being pushed away as the cranium expands. So we're just going to sit here for a little bit and try to feel that rhythm. Close your eyes. Take some deep breaths. Have your client take some deep breaths with you. Allow yourself to relax. And you might even feel kind of a tingling sensation, and that's normal too. And try to feel the actual pull into their head and then the actual pushing of those magnetic poles away from each other. I'm starting to feel it. Now you will not be able to see this on the video because it is so subtle. So we really need to just kind of practice this over and over until you actually feel that pull in and the push out. Now, this should happen very slowly. Remember again, 8 to 12 beats per minute. Once you feel the pulse, I want you to just sit with your client. Allow them to become deeply relaxed. As this happens, the tension in the membranes, fascia, and muscle tissues in their body will start to relax also. This will slow their cranial pulse even more. We want to stay in the position for however long it takes until we can actually feel the pulse slow to about 2 to 3 beats per minute. Again, this may take a long time. It could take 15 minutes, it could take 20 minutes, it could take a half hour. We need to just hang out with the client as long as we can to slow that pulse so that we can help bring them to that still point that we talked about earlier. Patience is your friend here. There is no rushing this technique. You must not try to rush the process or your client will not benefit to their full extent. Once you have started to feel the pulse and you are sure that you are feeling the cranial pulse and not just the heartbeat, that is when we will actually move on to the next hold. Craniosacral work is very specialized technique and should be considered a technique to be learned in a classroom setting where you can receive appropriate certification and also have someone be able to come over and kind of feel what you're feeling and make sure that you're actually feeling that contraction and expansion. You must not at any time consider this video to be a replacement for certification. Again, it is a very advanced technique and certification is very important to be able to move forward with this work. The video will give you that basic introduction and kind of give you a feeling of what this work is all about. And then you can decide whether you want further training or not. With hands-on work, you are dealing with more than just placing your hands on someone. You are affecting them physiologically, mentally, and emotionally. Please do not take this work lightly. With that said, we're going to move on to Vault Hold 2. Vault Hold 2. With this hold, we are going to place one hand under the head at the occipital ridge, like this. So you want to kind of cup your hand, so your fingers are kind of curved, and you're going to place them right at that occipital ridge, which is actually the base of your skull. And let their head kind of just wobble back and forth on your hand, because we want to have movement here. Then you're going to take your other hand, and usually it's your dominant hand for this part, and we're going to place the pinky and the thumb on the temporal lobes. Now, the smaller your hand is, like mine's pretty small, it can be difficult to actually stretch it far enough to hit those points, but as long as you are close, we're good. You're going to place those there and leave these fingers kind of hanging up here. And we're going to lift our fingers a little bit so we kind of feel a resistance in the skin. This lift is going to help release the tension in the membranes, muscles, and the fascia in a different direction. Now, as you can see, the client is already starting to move a little bit, and you just want to follow the client as they release. What this means is that the client may start to kind of unwind. And as you see with Dawn right now, she is moving to the right, which is an indication that she has probably some tension in her neck. You can see her going. So we're going to actually just kind of stay with this hold a little bit so that you can actually see what's going to start to happen. Now, if you can see, she stopped moving. So sometimes what I will do is actually do a little stretch like this, because I can tell that those muscles are probably tight because she's naturally stretching her neck on her own. And then I'll bring the client kind of back to center and start again. If a client really starts to unwind, they might get a little dizzy, because I'm going to just kind of show you what can happen. Let me know if this is too much for you, Don. But their actual head can start unwinding like this, and they can actually become dizzy. Now, if that happens, have your client open their eyes, because that kind of brings them back to center. And actually, by doing that, I kind of stimulated Dawn moving even more, as you can see here. A client must be reminded that they will only release as much as they want to, and that they can always go back to where they left off at another session. What's cool is that the body always remembers where it stopped in a previous session. Sometimes you may need to replace your hands again. So you want to just continue this hold, allowing the client to release as much as needed. Now, what may begin to happen also at this point is that the client may start releasing down the spine, at the hips, or in the arms. Remember, everything is connected in the body, and the craniosacral work is helping to realign the entire body. Before I move on, I think I'm just going to sit a little bit here with Dawn so you can actually see what these releases are. Again, she stopped. So I'm going to do a little stretch her neck. Remember to keep yourself comfortable and relaxed. And you can just hold that stretch for a few seconds. You may also notice too that the client's breathing will change. And that's completely normal too. It may speed up or it may slow down. So we'll go back to center again. As you help to facilitate this movement, the client may experience some remarkable releases, as you already noticed. You are there to guide them through this. As I stated earlier, this video is giving you an introduction to this work, and I highly recommend further training so you can deal with and understand what's happening with these releases. Once the client has released to the full extent with that hold 2, we would move to the actual hold 3. With hold 3, you will be placing your hands like this. First, you want to kind of cup them together with your fingers up, because you're going to be resting on the table, and their occipital ridge is going to be resting on the tips of your fingers. So let's do that. You will be cradling the client's head in your hands. Your fingertips, like I said, are based at the base of the cranium. This is referred to as your occipital ridge. Now, you want your hands to be resting on the table and your fingers to be positioned at the base of their skull. Having short nails is extremely important here, as to not injure your client with your nails, so remember that. The client's head will be totally relaxed. They should not be holding their head up. You want them relaxed. Your hands and fingers should actually be supporting the weight of their head. Now, this hold is usually the hold that truly encourages a release in most people. Dawn started to release with the second hold, and that's great. But some people don't start to release till we actually get to this third hold. It is very important, again, that you stay focused. You will find that the client's head will move from side to side sometimes, or they might even arch their neck, or may have releases throughout the rest of their body. Everything is normal. Allow the client to release, but you must always stay present to provide physical support and the support mentally and emotionally for the client. And also you want to make sure that the client doesn't hurt themselves. So remember, you are the facilitator. I'm going to stop for a second here and just actually tell you what's happening with Dawn right now. Is I'm feeling like a pull down towards her feet, like it's pulling my hands with it. And then sometimes it's expanding back up towards me. So I'm not making the movement, I am just following her movement. We're getting a lot of release here. So we're just going to let her release and we'll see what happens. She's just releasing just a little bit. You can see a subtle kind of unwinding, almost in a circular motion of her head right now. Do you see that? Yeah, that's great. So she's really releasing at the base of her skull and also down her entire spine right now. We can't see this in the video, but her feet are even unwinding in a circular direction. Just helps us to remember how everything is connected. Now you can see her starting to release a little more. I won't let her release completely for this because later on we are going to do some actual unwinding where they really start to release, and we'll move her to the floor for that. You may start to see them releasing, like I said, even more through their spine, which she's starting to do a little bit. If they start to release again at their lower back and hips, you may go to the belly and the low back, which I think we'll do right now so that you can see how that works. And when that happens, you just want to gently place the client back to center. And once you pull your hands away, usually the client will stop their release. She's going, she's got to go against me here. She's still going a little bit, and that's okay. But we're going to move now to the abdomen and the sacrum area so you can see what we can do down there. Like I said, if they start to release further down the body, and you can sense that, we would want to move to the abdominal area and the sacrum. Now, with this, we're going to be placing one hand over the belly, and then we're going to slip another hand under their low back, pretty much at that sacrum area. This position can help them to release at the abdominal and low back, sacrum, and hips. Much easier because we're going to help facilitate it. So I'm going to place one hand under your back. That's okay. I'm going to place it right over your sacrum. So my hand is resting on the table between her sacrum and the table. Now, you can see that I'm really having to bend down, so sometimes what I'll do is I'll actually kneel down on the floor so I'm a little more comfortable. And then I'm going to place the other hand over her abdomen. Now, again, we might start to feel some actual releases here, and what may happen is that, I'm going to pull my hands out here for a second, that you might feel your hands kind of going like this with their body as they're releasing sideways, and they also might go up and down. Just follow the client and allow them to release, and try to stay as relaxed as you can. And the heat from your hands can also help with this release. So I'm actually not getting much of a release here, but I'm going to kind of induce one so that you can see what may happen. So what may happen is your hand will actually start to pull this way with their fascia, and then my hand underneath you can't see, but it's pulling towards me. And actually, sometimes if you do kind of initiate the movement, they'll start to unwind on their own. Also, sometimes what will happen is your hand will move like this in a circular direction. It might go clockwise or it might go counterclockwise. Just hang out there for as long as you can until you actually feel the client moving. Once they start moving, stay with them a while, and then when they stop, that's usually an indication that that area of the body has stopped unwinding, and you can actually move to another area of the body. We're probably going to get more movement from Dawn later on when we actually do some work with her on the floor for unwinding. But now you know where to go and where to place your hands for the low back and the abdominal release. So now I am actually going to move back up to their head to show you the next hold. Now we are moving back to the head like I said earlier. What we're going to do sometimes is we may go back to the actual hold 1, which was this hold for the still point, and start all over again. This process could go on for quite a while, and you must be prepared to travel back and forth quite a few times. It's a normal reaction and should be encouraged. So we may go back and forth between each vault hold multiple times. We may find ourselves moving down to the abdominal and sacral area. Just move back and forth, but just always start with that hold 1. If the client or yourself get to a point of exhaustion, you must stop and come back to the release in another session. The client can become very exhausted, and so can you, and you don't want them to feel that way. You want them to feel energized when they leave, so you can always come back to that release at another session. When you are ready, you will move to the final hold, which is actually the same as hold 1. And this was this hold right here. This we will call hold 4. We're going to place our hands on either side of the head, trying to place our fingers touching all of those suture points. Now, the client may start to release again at this point, and you want to stay with the client in this position for as long as needed. You may find that you will need to go through all of those holds again a few more times, and just remember that's all part of the process. The client and the client's body will let you know when they are finished with the treatment. Just follow their lead. And the indication of that would be that they are balanced and they're not moving around anymore. That would let us know, okay, the body has internally balanced itself out and we're okay to end the session. What I'm going to do now is I'm going to go through each individual hold so that you can actually see the holds close up. So we are going to start with hold 1. Again, this hold is used to try and have the client reach that still point. Place one hand on either side of the head. Try to rest your arms on the table like this, making sure that your fingers are touching all those suture points. So again, we have the frontal lobe and parietal lobes kind of coming together here. That's where my thumbs are going to rest. I have my pointer fingers resting and my middle finger resting kind of on the temporal lobe. And then my ring finger and pinky finger are covering the rest of the parietal lobe and part of that occipital lobe. Now again, the smaller your hands are, and depending on the size of the person's skull, you might not be able to spread your fingers as far as you need to touch all of the suture points, but do the best that you can so that you are able to affect all of those. So we're just going to hold this so you can actually get a nice close-up of where your fingers need to be. Good. Now we will go on to hold 2. Hold 2 again, we want to place one hand underneath their head so the occipital ridge is balancing right on the fingertips. So let me just show you here on the side. My fingertips are going to be kind of tucked right at that ridge of the skull. And then the rest of my hand is just covering the back of the occipital ridge and part of the well, mainly just the occipital bone. So like this. Their head may kind of go back and forth, and that's okay. With the other hand, you want to take your pinky and your thumb and try to place the pinky and the thumb on either side on their temporal lobe. You want to pull up slightly so you feel a little resistance in the skin, and just let these fingers kind of rest above. When I'm done with this hold, I'm actually going to show you an alternate hold that you can do too. We'll start with this hold first, which is hold 2. Good. Now an alternate hold that you can do if you're feeling like you want to get more release here at the temporal area is to take each hand, taking the 3 middle fingers and placing them right over this part of the head, which is part of that temporal lobe. So we're going to do it on this side and then also on the other side. And again, we're going to kind of lift up till we feel resistance. With this one, you can actually get some nice movement. You might feel it more with your hands. So their head may not be moving around, but their actual skin will feel like it's moving underneath your fingers, and that actually is the tension releasing in that connective tissue. Sometimes too with these holds, remember the client will have bodily reactions. Like I said, their breathing may change, it may slow, it may speed. Sometimes too their eyes, you'll see their eyelids moving, and it's just a normal twitch response to the release. So we'll just call this alternate hold 2. Good. Now for hold 3, we're going to place our hands like this underneath them again, and their occipital ridge is going to be balancing over these fingertips. So I'll have Ryan turn his head to the side just so you can kind of see. So they're right along that ridge. And you want the client's head to be relaxed. And you can see my fingers, how they're kind of pointing upwards. We want to stimulate this release a little bit with a little bit of pressure that's created by the weight of their head on my fingertips. Again, this is hold 3. Good. Again, the last hold, hold 4, is the exact same as hold 1. So we want to place our hands on the side of their head, trying to make sure that our fingers are again touching the frontal lobe, the temporal, parietal, and occipital. And try to always keep yourself as relaxed as possible. Good. Now I'm going to show you the abdominal sacrum hold. Again, you want to take one hand and place it underneath the client. Let them know that you're going to place your hand at their sacrum. Go ahead and rest. And then they're going to lay back down. You don't want them to hold their body up. And your hand is laying flat like this over the sacrum. And then the other hand you're just going to place over the abdominal area. And then, again, we are just going to hold this hold so you can see the placement. Okay. So I have laid the client on the floor at this point to demonstrate another sacrum abdominal release that you can perform for the client. Now this is going to look a little bit different, and you really have to position yourself correctly and explain to the client exactly what you're going to be doing so that they feel comfortable and safe with you. So what I'm going to have you do, Ryan, is bend your knees. And what I'm going to be doing is taking my arm and placing it between his legs and up underneath his sacrum. And then he's going to lay down so that his sacrum is resting on my hand. And then I'll be putting my other hand over his abdomen. This, because of the pressure of their body resting on my hand, it can help to really release that low back, which is so important because so many people have tension down there, okay? So, Ryan, I'm going to be having you lift up a little bit. I'm going to place my hand at the sacrum. Okay, go ahead and lay your legs flat. And then I'm going to place my other hand over his abdomen. And with this release, they may really start to kind of release again at the abdomen and the low back. And your hand may start to move a little bit on the sacrum. And that's good because that means that tension is really starting to release. And this can actually stimulate quite an unwinding for the client. And you want to hang out here as long as you can. At some point, the pressure of their body on your hand may become uncomfortable. And then at that point, you can just remove the hand and move on to another area. And you can always come back to this area. So this again is an abdominal sacral release point. Okay? All right. Put your knees back up, and then you pull your arm out.
This technique that I'm going to show you now is wonderful to incorporate into your current massage routine if you are a massage therapist. It is called the ear pull. And what I will do is I will place my thumb and my fingertip of my index finger, into the client's ear, gently. So the thumb will go right here, and my index finger will just go on the other side, on both sides. I will gently pull. Now, what I tend to do, okay, she's releasing right away, is I will kind of follow the way the client guides me. It's the way the fascia is releasing around that area. This can help open up around the cranium to get that cerebrospinal fluid moving. You can also feel and sense tension around this area as well. So just follow it. Again, if you feel the need to release this hold, you do so. If your client seems to be moving around a lot, but she is in control and can stop at any time. Okay, that was the ear pull technique.
Once you get your client to the floor, you want to make sure that they are comfortable and that they understand that they may be moving around quite a bit and that that's okay. So, Dawn, you understand you may roll, you may find that your head starts to move, your arms may start to release, your legs may point out. Sometimes the client may even feel like they want to sit up. You, as the facilitator, are just going to guide your client through these movements. Now, if you perform the craniosacral work first, that can really help to have them release easier for the unwinding. So sometimes I'll have them start out on the massage table, I'll perform the craniosacral work, and then we'll take a break because sometimes they need that, and then I'll set up so that they can lay down on the floor and we can actually start doing some major unwinding over the rest of the body. So with Dawn, I am going to always start back at the head like we did with the craniosacral work. So I always go back to the point of that first vault hold. So I'm going to now have her scoot down a little bit. Make sure that you are comfortable. I'm sitting in what they call kind of a yoga sit. I'm sure there's other terminology for that, but this is what I call it. So you can sit this way, or you can also sit like this. Okay, so I'm actually going to stay in this position. So I'm going to have Dawn just relax. You can lay your legs flat if you want, or leave them crossed, however. And I'm actually going to start with the third vault hold, where my hands are like this underneath her skull, and see if we can stimulate some releases. So I'm going to sit here for a little bit and see if we can get some release from Dawn. Already her neck and head is starting to release a little bit. And I'm just going to follow the releases. It's really important that you always just kind of follow what the client is doing and let them kind of initiate the movement. Here I'm going to do a little bit of a stretch. I'm going to bring her back to center. Do another back to that third vault hold. And then she starts to release to this side. You can see that she's curving a little bit at her side. And sometimes too what I'll do is just grab onto the arm and do a little pull. See if we can stimulate some releases down the low back. The arm back. Bring her back to center. Do a little pull. Go to this side. And actually you can see that her arm moved a little bit, so I'm going to go back to this arm. You can see that her hips are starting to move some. And I'm just stimulating the movement a little bit. Now that I see her moving more at the legs, whoops, we're getting some unwinding at the neck. And this again, remember, if they let them know, if you get dizzy, just open your eyes. Let me do another stretch here. Good. Now this can really allow, now she's arching a little bit, so I put my hand underneath her shoulder and I'm kind of moving with her. And actually sometimes people go into positions that you don't even think are possible. And then I felt her get stuck there a little bit, so I'm going to initiate the stretch again. Good. Okay, she wants to keep unwinding at the neck. Now she's moving around quite a bit, so you can see how this is good to have this, have them on the floor, because they're going to be much more comfortable. And I'm actually going to move now to her hips. I'm actually going to have you go back into that position that you were in. And I'm going to do a little stretch here. I'm going to push kind of this way, but I'm holding on to her opposite shoulder here. And get a nice stretch down the spine. Feels good. Okay, good. We can move to the legs too. We can kind of pull the legs out. Actually, I'll have you scoot up, Dawn, if you can, to the top there a little bit. A little more. All right. And I'm holding on at the heels. And I'm just going to kind of do a little rocking move here. And this sometimes can really help them to release at the sacrum area and the hips and the low back. So now we're actually getting some unwinding here. Let me know if it's too much, Dawn.
Feels good.
Okay. And you'll kind of feel a momentum. See, and all of a sudden they might stop and then reverse. And that's what was happening there. Again, this is something that would be beneficial to learn in a classroom setting. So we're just giving you kind of a little introduction again. You can see she kind of went to the side there, so I'm going to kind of do that stretch again. And sometimes too, what will happen is they might have a natural adjustment to their spine, and that's completely okay and completely normal. You are not adjusting the client, you're just helping them stretch. And sometimes they'll just decide they want to roll over.
I feel like I want to twist.
She's saying that she feels like she kind of wants to twist. And look at that. I mean, this isn't a normal stretch that would normally happen by yourself, but someone is helping to facilitate that. Okay? Can I have you straighten out again for me? This way?
Oh.
And then I'm going to just kind of come up here, and I'm going to pull on her arms, both of them at the same time. Have you hold on to my wrists. A nice little stretch. And if she puts her legs flat, she'll also feel the stretch through her spine, but also through her abdomen. Okay. And then sometimes what will happen is if the client is in this position, they'll almost feel like they want to release to the other direction. And we're just going to there, and then if this happens, you can move, you really have to move with the clients. This can be very exhausting, like I talked about earlier, and just kind of help them. But always be present with the client so that they feel safe, and also so they don't hurt themselves. And then sometimes what will happen is they'll want to just arch their back like it's happening with Dawn in the other direction. Just stay with the client, allow them to unwind. Good. Are you doing all right?
Yeah, I'm doing good.
And then sometimes they'll want to stretch forward. And really, it's a wonderful, lots of people who aren't even this flexible will become this flexible during a treatment. Okay, good. I'm going to have you lay back down. If the client ever gets tired, just place them back in that position where they're laying comfortably. And just kind of hold on to their head again. And she's still unwinding, so you want to stay with the client and allow them to unwind as long as they need. I do find sometimes too, just like I did earlier, have you hold on to my wrist, doing this stretch again will stimulate some release for them further down the spine. Okay. And now if you see what's happening with her legs, her pelvis area is wanting to stretch a little bit, so I'm going to place a hand on each hip, or one on this hip, and then I'll just kind of push with my other hand on the leg. They can get a nice kind of stretch through the pelvis area. Remember, you're not pushing, you're just kind of stimulating a stretch. Okay, good. Right, back to center. We'll bring both of her arms up again, grab my wrists. Just gonna do a nice little, there we go, nice little pull. A client may be taller after this treatment because it's really stretching out the vertebrae and opening up so that cerebral spinal fluid can flow through the client. Another one that works pretty well too is actually placing kind of a hand underneath, just one hand at the occiput, and is it okay if I place my hand right here? Mm-hmm. And placing your hand on their upper chest at the sternum, and then just kind of push down towards their feet, but hold on to their head. So you're pushing down with this hand and kind of pulling towards you with the other. This can help to really release tension in the sternum. And if any of you are energy workers, you're also placing your hand over their heart chakra, which is our emotional center. So sometimes by doing this, you will get those emotional releases. And we can see that her head keeps stretching to the side, so that's an indication that her neck is really tight. So we want to keep moving with that. This arm is starting to move, so we're going to bring that up. Always want to try to hold on to their head and help them guide that head. Good. All right, we're going to do one last pull here.
Oh, I feel like I have to... Sorry.
It's all right. She's releasing a little bit more here. And this is what will happen, so you really just need to follow the client. A little better?
Okay, yeah, thank you.
And since she did that, actually, what I'm going to do is have you lay this arm down. I'm going to bring this arm, hold on to this hip, and I'm going to do a nice little twist here. Good. Now we can see that she's laying pretty straight again, and that's good. We'll do a nice little pull, the occipital ridge, just kind of stretch her neck out. And it's always good to end after they've done their myofascial unwinding and they feel pretty much like they've balanced out. It's good just kind of end with that first vault hold again. And your client will do what they need to do, like Dawn just did. She stretched herself out there a little bit. And we just kind of have the client focus on breathing and just have them relax and kind of bring them back to center and back to being grounded again so that they feel kind of connected to their body, because sometimes with this work you can feel very disconnected as a client because you're moving around so much. So we need to bring them back to center before we have them sit up. How you doing? Okay. You will help your client to sit up. And the client is probably going to feel very relaxed and possibly lightheaded. And you will want to stay with them until they feel like themselves again, just more relaxed. Next, we are going to have Dawn, my business partner, come in and demonstrate some additional myofascial unwinding techniques that you may want to incorporate into your treatments. And here we have Dawn.
Hi. What I'm going to do is I'm going to show you some different ways that you can also use these techniques if you find that some of the techniques you're using aren't creating the results maybe you want. So I'm going to be working on Maria for this part. So what you could do is to help release the shoulder girdle, I will place my hands gently on each side of her shoulder. And this is great for your clients who do have shoulder issues and pain. And they may go, well, why aren't you doing anything? Because the technique is gentle, it won't feel like much is happening. But remember, that fascia is going to warm up and it will start unwinding and become more pliable. Okay? As you can see, Maria really wants to start moving. So I'm just going to stay with her. And she feels very warm here. So she may be just holding a lot of tension here. You okay?
Mm-hmm. Yeah, I really feel it releasing in my spine. My arm wants to kind of unwind a little bit here.
So I'm just going to follow her lead, okay? Now, this may not happen with your client right away, but Maria has been receiving body work for a number of years, and so her body wants to release, and it will go.
I guess my shoulder girdle was tighter than I thought.
You will find yourself moving around quite a bit with your client if they do start releasing. Okay. You will find as well your client may become sore the next day, and this is just because you're releasing an area that was holding a lot of tension. Okay? I'm just going to keep going with her. I'm just following her. Okay, I'll stretch her. Okay.
Yeah, that feels really good.
Good, so I'm just going to go ahead and come back and just hold it a little bit. Maybe I'll do a little stretch here. Okay. All right. Now, if your client did not start releasing the way Maria did, what you could do is just keep your hands here and just hold it here until you feel that release a little bit. You might find that just what's happening here. My hands are just kind of moving back and forth. I'm following her body, which is wanting to release. I'm going to go ahead. Looks like she wants to just follow the client's body. I'm just going to do a little stretch down at her hip and her shoulder. Okay, you doing all right?
Mm-hmm.
Okay. All right. So you could do that on both sides for the client. Now let's try another one. I'm going to have you lie down on your back.
Okay.
Ooh, it popped. I'm still releasing from mine. And then I'm going to have you bend your knees. And then what I'm going to do is I'm going to take them and I'm going to get her into an alignment so her knees and her hips are nice and straight. And then my job will be just to have you take a nice deep breath in, Maria. I'm going to use a little bit of compression. You know, again, this is one of those things that if your client has a sore sacrum or right flat on the ground, it can be a little painful. So you want to just make sure that you put some padding underneath if they need it. And just allow, doing okay? Mm-hmm. Allow their hips to unwind.
My sacrum just adjusted.
Good.
I'm going to interject here
Okay.
as Dawn is working on me because I would like to say too that sometimes really helping to loosen up that sacrum and pelvis area sometimes can be helpful for women when they're trying to get pregnant because it can open up a lot of the tension that exists in that area and help the blood flow
Absolutely.
down into that part of their body. So this can be very helpful and a treatment used for people that are going through maybe some difficulty getting pregnant. It's not guaranteed,
Absolutely.
but it can definitely help.
That is a very true statement, and energetically as well, on all levels. And it just feels good to have somebody help you unwind. How are you doing?
Good, it feels
Good.
great.
You look like you're nice and relaxed. Okay, what I'm going to do is I'm just going to take this one leg and I'm just going to go ahead and give you a nice stretch. Doing okay?
Mm-hmm.
Be aware that you do not use too much pressure over the tibia because that's that bone directly there, so you just want to be aware of your pressure on the leg. Okay. Good. Okay, so that was a wonderful technique that you can use for the hips. I'm going to show you another technique that you can use for the spinal column. So what I'm going to do, and I'll do a quick talk about it first and then we'll go ahead and move into the technique. So what I will do is I will gently place my hand on the top of Maria's head, and then I'm going to take my other hand and I'm just going to place it gently at her shoulder. And then what I'm going to do is I'm going to have you take a nice deep cleansing breath in, Maria. And exhale. Okay, looks like she wants to go. So what you're doing is you're just placing your hand there. You're not compressing because you don't want to put any extra stress on the spinal column. And so what she's doing is just releasing.
And as the client, I'll tell you, I'm getting a lot of clicking in my neck
Mhm.
and all the way up to my atlas, which is great. I'm just getting a nice, gentle adjustment.
So it's all natural. You are not manipulating any. Good, good, good. when you're performing this type of work as well, you can't really give it a routine per se. You need to just trust what you feel and move with the client. Okay? So it is really about trusting your gut and following it. Okay? So I'm here with her, and she can allow her body to just release the way it needs to. Okay. She's still going, so I'm going to let her. Oops, so there's a nice little click there. So we can actually, as you can see where my hands are, we can help release the thoracic area. We can help open up this area, as well as Marie talked about earlier, you're working with the heart chakra, if you're an energy worker. Okay. You doing okay?
I feel great.
Good. Okay. So my instincts are just telling me to come over here and I'm just going to just apply a little bit of pressure here. Okay, so that is another way that you, as the practitioner, can place your hand up on the client's crown, and I want at the shoulder, and like I said, just a little bit of pressure up there, and it's just allow them to start unwinding as they need. Now, they may not unwind, that is okay. Your gentle touch at the cranium will help that cerebral spinal fluid to move the way it needs to. Okay?
It's important that you always make sure that your client feels comfortable and relaxed and centered, and that you get them some water to drink right after the treatment, and then we're going to chat with them a little bit, because you want to talk to the client about how they are feeling. And you may need to set up a treatment plan with them for more craniosacral treatments, and possibly they want to continue with the unwinding. You know, the unwinding kind of goes hand in hand with craniosacral work, and you may not have a client unwind like this client did here in the demo of the unwinding until later on, once they've had quite a few treatments and become more comfortable with you and have gotten to the point of allowing themselves to release. Remember that one treatment is usually not enough. Your client will have to receive a series of treatments to help them to reach their goals. Make sure that you stay in contact with their other medical providers. You also want to be sure to obtain a signed release from your client to share that verbal and written information with other providers. You cannot share a client's confidential information without their approval in writing. For more information regarding client confidentiality, etc., you can go to www.hipaa.org, and they will give you lots of information about signed releases and confidentiality agreements. You will also want to be sure to remember that this video is an introduction, again, to craniosacral and unwinding. I do encourage you to receive further education in this technique before you can officially consider yourself to be a craniosacral therapist. This work may be gentle and subtle, but it affects the body on very deep levels, and as you saw with Dawn's unwinding, very intensely at times. So a background in the healthcare industry, such as an MD or a nurse or a doctor of chiropractic, massage or body work, acupuncturist, is kind of a vital necessity if you are to perform this work professionally. Remember, You must be sure to get a complete medical history on your client as to give them the best and safest treatment that you can. We must always know our client's condition before performing any work on them. Now, if you would like to receive further training and or a certification in this work, please check with the organizations that I mentioned earlier, or you can also go online and learn about other credible workshops that may exist. I hope that you enjoyed this introduction to craniosacral work and unwinding, and I wish you the best of luck in your healing arts career. If you would like further information on this video or others, please go to www.massagenerd.com, or you may also visit www.therapeuticschoolhealingarts.com for information regarding my continuing education school and our schedule of upcoming classes. Thank you for allowing me to introduce you to the fascinating technique of craniosacral work and myofascial unwinding.